Anatomical terms help us to identify the location of both internal and external body structures. Most of these terms are used to identify where something is located on the body relative to another body part. These terms refer to the locations of human body parts as they occur in the universal anatomical position. The anatomical position is an upright standing position with arms at the side, palms facing forward, and both feet together. When we need to describe the location of a body part as being above or below another body part, we use the terms superior and inferior. When a body part is superior, it is considered vertically closer to the top of the head in the anatomical position. On the other hand, a body part is considered inferior if it is closer to the bottom of the feet. For example, with the abdomen as the point of reference, we could say that it is both superior to the pelvis and inferior to the chest. When we need to describe the location of a body part as in front of or behind another body part, we use the terms anterior and posterior. Like other anatomical directional terms, a body part being either anterior or posterior depends on the point of reference. Anterior is towards the front of the body, while posterior is towards the back of the body. For example, the nose is anterior to the ears, and using these same points of reference, we can say that the ears are posterior to the nose. Please note that the terms ventral and dorsal are also used interchangeably with anterior and posterior when referring to both human and animal body parts. However, the terms anterior and posterior are mainly used for locating human body parts. If you want to describe the location of something that is relative to the middle of the body, you would use the term medial. To identify something located medially, you would create a midline division of the body. The midline is an imaginary line that goes from top to bottom and divides your body into two equal parts, left and right. When you have the midline, the body part that is closer to the midline division is medial to the structure farther from the midline. The structure that is farther away from the midline is referred to as lateral. Whether you use lateral or medial to describe a structure largely depends on the site you have to describe. Here are some examples. The bicep muscle in the upper arm is lateral to the pectoral muscle in the chest. Further, in the anatomical position, we could say that the pinky finger is medial to the thumb. Proximal and distal are used to describe the location of points on a limb relative to that limb's connection to the torso. The proximal site is the one that is closer to the limb's point of attachment, while the distal site is the point that lies further away from the point of attachment. As an example, the wrist is considered distal to the elbow, and the elbow is proximal to the wrist. Superficial refers to a location towards the surface of a body structure or organ, while deep is concerned with the location that is towards the center of a body structure or organ. For instance, if we look at a cross-section of the skin, the top skin layer, called the epidermis, is superficial to the subcutaneous layer. The subcutaneous layer is considered deep to the epidermis.
The human body consists of 206 bones, which scientists classify into 4 groups: long bones, like those found in the arms and legs, short bones found in the wrists and ankles, flat bones such as the scapula and the sternum, and irregular bones such as the vertebrae and hip bones that don't fit neatly into the other 3 categories. The skeleton itself is further divided into the 2 categories of axial and appendicular for ease of study and reference. The skull is the part of the axial skeleton that encases the brain and provides support for the teeth. 2 orbits on the front house the eyes. Below are the nasal bones and nasal cavity. Small air-filled pockets on either side of the nasal cavity hold the sinuses that connect with the respiratory system. The maxilla anchors the upper row of teeth. The jawbone or mandible holds the bottom row of teeth. Attachment points on each side are rounded and connected in such a way that allows the jaw a wide range of motion. It is this mobility that makes it possible for us to chew our food and talk. The cranial vault is made up of plate-like bones that meet at lines called sutures. The cranial vault, together with the cranial base, provides a secure cavity for the brain. An opening at the base of the skull serves as a point of entry for the spinal cord. The vertebral column surrounds and protects the spinal cord. When we are born, it consists of 33 separate bones or vertebrae, but as we age, some of these vertebrae fuse together. The 4 at the bottom form the coccyx or tailbone. Just above the coccyx are another 5 fused vertebrae that form the sacrum, the point of attachment for the hips. Above the sacrum are the unfused vertebrae. The top 7 cervical vertebrae are the smallest, lightest, and weakest vertebrae. Next are the 12 thoracic vertebrae. In the back, the thoracic vertebrae form the attachment points for the ribs. The 5 lumbar vertebrae increase in size as you move downward. The third component of the axial skeleton is the bony thorax or rib cage, which consists of the sternum or breastbone, the ribs, and the 12 thoracic vertebrae mentioned before. The first 7 ribs on each side are called the true ribs because they connect directly to the sternum through short pieces of cartilage called costal cartilage. The next 3 are called the false ribs because each is connected to the cartilage of the rib above it rather than directly to the sternum. The remaining 2 floating ribs don't connect to the sternum at all. The appendicular skeleton consists of the appendages, or additional parts that are attached to the axial skeleton. The arms and hands are connected through a series of bones called the pectoral girdle.
One of the most interesting things about the pectoral girdle is that all of the bones join together with very loosely fitting joints. This gives our arms and shoulders a very wide range of motion, much more than we find in the lower limbs.
The pectoral girdle consists primarily of the clavicle or collarbone that is attached to the sternum on one end and the scapula or shoulder blade on the other end. The upper arm, also called the brachium, consists of a single long bone called the humerus. The forearm, or antebrachium, consists of the radius and the ulna. The ulna is slightly larger than the radius. The carpus, or wrist, consists of 8 small carpal bones that fit together almost like a jigsaw puzzle. The hand itself consists of 19 bones. The 5 bones of the palm are called metacarpals. If you make a fist, the knuckles are the ends of your metacarpal bones. The 14 remaining bones of the thumb and fingers are called the phalanges. The lower appendicular skeleton is attached to the axial skeleton by the pelvic girdle. The pelvic girdle consists of the ilium, the ischium, the pubis, and the coccyx and sacrum. A ball and socket joint joins the femur to the pelvic girdle. The femur is the longest bone in the body. The other end of the femur joins the tibia, the larger and stronger of the 2 lower leg bones. The other leg bone is the fibula, which is situated parallel to the tibia. The patella, or kneecap, strengthens and protects the knee joint. The distal, or far end of the tibia and fibula, are connected to the tarsal bones of the ankle. The bones of the soles of the feet are called the metatarsals. And like the hands, there are 14 bones in the toes called phalanges. The bones of the feet are positioned to form arches on the soles of the feet. Flat feet, or fallen arches, are the result of ligaments that hold the arches in place becoming stretched out. This often makes walking and standing difficult and uncomfortable.
Types of bones found in the human skeleton. There are 5 types that are generally recognized, and they are identified by their forms, either endochondral or membranous, and by their general shape. They are the following: long, short, flat, sesamoid, and irregular. We'll start with the long bones. They have a more complex anatomy, so this will be the most challenging group to learn. Long bones develop via endochondral ossification, a process in which the hyaline cartilage plate is slowly replaced. A shaft, or diaphysis, connects the two ends known each as the epiphysis. The marrow cavity is enclosed by the diaphysis, which is thick, compact bone. The epiphysis is mainly spongy bone and is covered by a thin layer of compact bone. The articular ends participate in the joints. The metaphysis connects the diaphysis and epiphysis at the neck of the bone and is the place of growth during development. This group of bones includes the humerus, ulna, radius, fibula, tibia, femur, metacarpals, and phalanges. Next are the short bones, which consist of a thin external layer of compact bone covering a vast spongy bone and marrow, making a shape that is more or less cuboid. The carpal and tarsal bones fall into this category. In flat bones, two layers of compact bone cover both spongy bone and bone marrow space. They grow by replacing connective tissue, and fibrocartilage covers their articular surfaces. This group is compiled of the skull bones, ribs, sternum, and the scapulae. A thin layer of compact bone covers a mass of mostly spongy bone in our next group, the irregular bones. This group is not categorized by shape, but by bone content and includes bones of the skull, vertebrae, and hip. Sesamoid bones are found at the end of long bones in the limbs, where the tendons cross. For example, the patella bone in the knee. They protect the tendons from excess wear by developing within the tendon and reducing friction.
In March of 2015, American astronaut Scott Kelly and his Russian colleague Mikhail Kornienko began an unprecedented mission in space. They began a one-year term of service aboard the International Space Station, the longest tour of duty ever served on the ISS. We know microgravity is hard on a body, and this mission is largely about testing the physical effects of being weightless for so long. Astronauts often experience things like trouble sleeping, puffy faces, and loss of muscle mass, but perhaps the most serious damage a microgravity environment causes is to the bones. And bones, well, they're pretty clut. They're actually as dynamic as any of your organs and are made of active connective tissue that's constantly breaking down, regenerating, and repairing itself throughout your lifetime. In fact, you basically get a whole new skeleton every 7 to 10 years. In short, your bones do way more than just providing your squishy sack of flesh with support and scaffolding and the ability to move around. Your bones are basically how you store the calcium, phosphate, and other minerals you need to keep neurons firing and muscles contracting. They're also crucial to hematopoiesis, or blood cell production. All of your new blood, and we're talking like 1 trillion blood cells a day, is generated in your bone marrow, which also helps store energy as fat. Bones even help maintain homeostasis by regulating blood calcium levels and producing the hormone osteocalcin, which regulates bone formation and protects against glucose intolerance and diabetes. Which is why Kelly and Kornienko are heroes of science, and not just for scholars of anatomy and physiology everywhere, but for anybody who has bones. An average human body contains 206 bones, ranging in shape and size from the tiny stapes of the inner ear to the huge femur of the thigh. That's a lot of bones to keep tabs on, so anatomists often divide these structures first by location into either axial or appendicular groups. As you might guess, your axial bones are found along your body's vertical axis, in your skull, vertebral column, and rib cage. They're kind of like your foundation, the stuff you can't really live without. They carry your other body parts, provide skeletal support and organ protection. Your appendicular bones are pretty much everything else. The bones that make up your limbs and the things that attach those limbs to your axial skeleton, like your pelvis and shoulder blades, these are the bones that help us move around. From there, bones are generally classified by their shape, and luckily those names are pretty obvious. Long bones are your classic-looking dog bone-shaped bones, the limb bones that are longer than they are wide, like the tibia and fibula of your lower legs, but also the trio of bones that make up your fingers. Follow some of those long bones to your foot or hand, and you'll hit a cube-shaped short bone like your foot's talus and cuboid, or your wrists lacunate and scaphoid. Your flat bones are the thinner ones like your sternum and scapulae, and also the bones that make up your brain case. And your irregular bones are all the weirdly shaped things like your vertebra and pelvis, which tend to be more specialized and unique. But despite their variations in size, shape, and finer function, all bones have a similar internal structure. They all have a dense, smooth-looking external layer of compact or cortical bone around a porous, honeycomb-looking area of spongy bone. This spongy bone tissue is made up of tiny cross-hatching supports called trabeculi that help the bone resist stress, and it's also where you typically find your bone marrow, which comes in two colors, red and yellow. Red marrow is the stuff that makes blood cells, so you should be glad that you have some of that, and yellow marrow stores energy as fat. If you happen to be a predatory animal, yellow bone marrow can be one of the best sources of calories you can find. The arrangement of these bone tissues, though, can be slightly different from one type of bone to the next. In flat, short, and irregular bones, for example, these tissues kind of look like a spongy bone sandwich on compact bone bread. But in some of your classic long bones, like the femur and humerus, the spongy bone and its red marrow are concentrated at the tips. These flared ends, or epiphyses, bookend a bone's shaft or diaphysis, which instead of having spongy bone in the center, surrounds a hollow medullary cavity that's full of yellow marrow. Now, although bone can look rock solid, grab a microscope and you'll see that it's actually loaded with layered plates and laced with little tunnels. It's intricate and kind of confusing in there, but the more you zoom into the microanatomy of bones, the better you can see how they're built and how they function right down to the cellular level. Let's start with the basic structural units of bone called osteons. These are cylindrical weight-bearing structures that run parallel to the bone's axis. Look inside one and you'll see that they're composed of tubes inside of tubes, so that a cross-section of an osteon looks like the rings of a tree trunk. Each one of these concentric tubes or lamellae is filled with collagen fibers that run in the same direction. But if you inspect the fibers of a neighboring lamella, either on the inside or the outside of the first one, you'll see that they run in a different direction, creating an alternating pattern. This reinforced structure helps your bone resist torsion stress, which is like twisting of your bones, which they experience a lot, and I encourage you not to imagine what a torsion fracture of one of your bones might feel like. Now, bone needs nourishment like any other tissue, so running along the length of each osteon are central canals which hold nerves and blood vessels. And then tucked away between the layers of lamellae are tiny oblong spaces called lacunae. As tiny as they are, these little gaps are where the real work of your skeletal system gets done, because they house your osteocytes. These are mature bone cells that monitor and maintain your bone matrix. They're like the construction foreman of your bones, passing along commands to your skeleton's two main workhorses, the osteoblasts and the osteoclasts. Osteoblasts, from the Greek words for bone and germ, or sprout, are the bone building cells, and they're actually what construct your bones in the first place. In the embryonic phase, bone tissue generally starts off as cartilage, which provides a framework for your bones to grow on. When osteoblasts come in, they secrete a glue-like cocktail of collagen, as well as enzymes that absorb calcium phosphate and other minerals from the blood. These minerals form calcium phosphate, which crystallize on the cartilage framework, ultimately forming a bone matrix that's about 1/3 mineral, 2/3 protein. From your time in the womb until you're about 25, your osteoblasts keep laying down more collagen and more calcium phosphate until your bones are fully grown and completely hardened. So while your osteoblasts are the bone makers, your osteoclasts are the bone breakers, which is a kind of violent image. Maybe think of them as like a bone breaker downer. Although the two kinds of cells do exact opposite jobs, they're not mortal enemies. In fact, I'm happy to report that they get along fabulously and create a perfect balance that allows your bones to regenerate. It's like if you want to renovate your house, you gotta rip out all those busted cabinets and the musty carpeting before you can bring in the nice hardwood floors and custom countertops. These cells work in a kind of similar way, in a process that I'd argue is less stressful than home improvement. It's called bone remodeling. The supervisors of this process are those osteocytes, which kick things off when they sense stress and strain or respond to mechanical stimuli, like the weightlessness of space or the impact of running on pavement. So say you're out running and something happens, nothing to be alarmed about, but suddenly the osteocytes in your femur detect a tiny microscopic fracture and initiate the remodeling process to fix it up. First, the osteocytes release chemical signals that direct osteoclasts to the site of the damage. When they get there, they secrete both a collagen-digesting enzyme and an acidic hydrogen ion mixture that dissolves the calcium phosphate, releasing its components back into the blood. This teardown process is called resorption. When the old bone tissue is cleaned out, the osteoclasts then undergo apoptosis, where they basically self-destruct before they can do any more damage. But before they auto-terminate, they use the hormone hotline to call over the osteoblasts, who come in and begin rebuilding the bone. The ratio of osteoclasts to osteoblasts can vary greatly, and if you stress your bones a lot through injury, by carrying extra weight, or just normal exercise, those osteoclasts are going to be swinging their little wrecking balls non-stop, breaking down bone so it can be remade. made. In this way, exercising stimulates bone remodeling and ultimately bone strength. So when you're working out, you're building bone as well as muscle.
The human skull is made up of 8 cranial bones that surround and protect the brain, and 14 facial bones that form the underlying structure of the face and support for the teeth. With the exception of the mandible, the bones of the skull articulate with each other through joints known as sutures. Throughout the skull, holes known as foramina serve as passageways for blood vessels and nerves. Bones on the surface of the skull encase the brain, protect sensory organs, and serve as attachment sites for the muscles of the head and neck. These bones include the occipital bone, parietal bones, temporal bones, and the frontal bone, as well as the nasal bones, the zygomatic bones, the maxilla, and the mandible. Other bones become more visible only when looking inside the skull. The sphenoid bone makes up the anterior base of the cranium. It is a butterfly-shaped bone with a central body and 2 pair of laterally projecting wings. These wings form portions of the orbit. The body of the sphenoid features a depression known as the sella turcica, which houses the pituitary gland. Located between the orbits, the ethmoid bone makes up a portion of the cranial floor and also the roof of the nasal cavity. An inferior projection, the perpendicular plate of the ethmoid bone, forms part of the nasal septum. The crista galli projects superiorly from the ethmoid bone and serves as the attachment point for the falx cerebri, a dural fold. Extending laterally from the crista galli is the cribriform plate, a perforated area through which the olfactory nerves pass. The 2 L-shaped palatine bones form the posterior third of the hard palate, part of the nasal cavity, and a portion of the orbit. The small, thin lacrimal bones make up the anterior portion of the medial wall of each orbit. A groove known as the lacrimal groove helps to form the nasolacrimal canal, which contains a duct that allows tears to travel to the nasal cavity. The vomer is an elongated, plow-shaped bone that forms the inferior and posterior part of the nasal septum. The internal and external skull bones articulate precisely, forming an intricate structure perfectly suited to its functions.
The cervical spine has the important job of supporting the skull and allowing us to move our head to direct our vision. The cervical spine also protects the spinal cord, the connection between our brain and the rest of our body. 2 common anatomic terms are useful as they relate to the cervical spine. The term anterior refers to the front of the neck. The term posterior refers to the back of the neck. The human spine is made up of 24 spinal bones called vertebrae. Vertebrae are stacked on top of one another to form the spinal column. The spinal column is the body's main upright support. 7 vertebrae make up the cervical spine, often referred to as C1 to C7. The top vertebra, C1, connects to the bottom of the skull. The cervical spine curves slightly inward and ends where C7 joins the top of the thoracic spine. The base of the skull sits on top of C1, also called the atlas. 2 thick bony arches form a large hole through the center of the atlas. This opening is large because the spinal cord is wider where it first exits the brain and skull. The atlas has 2 relatively large bony projections on each side. The atlas sits on top of the C2 vertebra, also called the axis. The axis has a large bony knob on top called the dens. The dens points up and fits through a hole in the atlas. This specialized connection between the axis and the atlas gives the neck most of its ability to turn to the left and right. Each vertebra throughout the spine is made of the same parts. The main section of each cervical vertebra, from C2 to C7, is formed by a round block of bone called the vertebral body. A bone ring attaches to the back of the vertebral body. This ring is formed by two pedicles that connect to the back of the vertebral body and two lamina that join the pedicles to complete the ring. When the vertebrae are stacked on top of each other, the bone rings form a hollow tube that surrounds the spinal cord. The inside of this hollow tube is called the spinal canal. The bone rings provide a protective roof over the spinal cord. A bony knob projects posteriorly at the same point where the two lamina bones join together at the back of the spine. These projections, called spinous processes, can be felt as you rub your fingers up and down the back of your spine. Each vertebra in the spine has two bony knobs that point out to the side, one on the left and one on the right. These bony projections are called transverse processes. Unlike the rest of the spine, the cervical vertebrae have an opening that passes down through each transverse process. This opening, called the transverse foramen, provides a passageway for arteries that run up each side of the neck to supply the back of the brain with blood. Between each pair of vertebrae are two joints called facet joints. The surface of the facet joint is covered by articular cartilage. Articular cartilage is a smooth, rubbery material that covers the ends of most joints. It allows the ends of the bones to move against each other smoothly with minimal friction. These joints connect the vertebrae together and slide against one another to allow the neck to move in many directions. Except for the very top of the cervical spine, each cervical vertebra has two facet joints on each side. The facet joints on top connect to the vertebra above. The ones below join the vertebra below. When the vertebrae stack on top of one another, an opening is formed on each side of the spine called a neural foramen. A nerve root leaves the spinal cord through this opening, one on the left and one on the right. The spinal cord travels through the spinal canal, the hollow tube of bone created by the stacked vertebra. The spinal cord is made up of millions of nerve fibers. Two large nerves called nerve roots branch off the spinal cord at each level where two vertebrae come together, one on the left and one on the right. These nerve roots branch into the nerves that travel into the upper extremities, upper body, and to certain organs. Ligaments are strong connective tissues that attach bones to other bones. Several long ligaments connect on the front and back sections of the vertebra. The anterior longitudinal ligament runs lengthwise down the front of the vertebral bodies. The posterior longitudinal ligament attaches on the back of the vertebral bodies. The ligamentum flavum is a long elastic band that connects to the front surface of each of the lamina bones. Each set of facet joints is also surrounded by a joint capsule that is made up of ligaments. A special structure in the spine called an intervertebral disc sits between each pair of vertebrae. An intervertebral disc is made of two parts. In the center of each intervertebral disc is a spongy material called the nucleus pulposus. The nucleus pulposus provides most of the shock absorption in the spine. The nucleus is surrounded by the annulus, a series of strong ligamentous rings that attach to the vertebra above and below the intervertebral disc. The anterior cervical area is covered with muscles that run from the rib cage and collarbone to the cervical vertebra, jaw, and skull. The posterior cervical muscles cover the bones along the back of the spine and make up the bulk of the tissues on the back of the neck. A good way to understand the anatomy of the cervical spine is by looking at a single spinal segment. A spinal segment includes two vertebrae separated by an intervertebral disc, the nerves that leave the spinal cord between each pair of vertebrae, and the small facet joints that link each level of the spinal column. The intervertebral disc separates the two vertebral bodies of the spinal segment. The facet joints and intervertebral disc work together to allow bending and rotating of the cervical spine. The facet joints slide while the disc works like a flexible connection between the two vertebrae.
The thoracic vertebrae, seen here on this image highlighted in green from a dorsal view, are located in the middle section of the vertebral column, specifically inferior to the cervical vertebrae and superior to the lumbar vertebrae. These vertebrae span the large majority of the chest cavity area. The vertebrae are separated by intervertebral discs of fibrocartilage, which are flexible cartilage discs located between the bodies of two adjacent vertebrae that allow movement in the spine and have a shock-absorbing or cushioning function as well. In addition to providing shock resistance and cushioning, the discs also help bind adjacent vertebrae together. There are 12 thoracic vertebrae denoted as T1 to T12, found in adult humans, and they are situated in between the cervical and lumbar vertebrae, with a general sizing larger than the cervical but smaller than the lumbar vertebrae. For each of the 12 thoracic vertebrae, there is a corresponding pair of ribs attached to them. This is unique, since no other vertebrae have ribs attached to them. Thoracic vertebrae increase in size as they descend towards the lumbar vertebrae. This is because the lower vertebrae must be able to support more of the body's weight when a person is standing due to the effects of gravity. Distinguishing features of the thoracic vertebrae include the presence of facets on the sides of the bodies for articulation with the heads of the ribs, and facets on the transverse processes of all except the 11th and 12th vertebrae for articulation with the tubercles of the ribs. The superior costal facet, seen here highlighted in green on this image of the lateral view of the vertebra, is a fossa where the head of the rib articulates. The inferior costal facet also articulates with the head of a rib. However, it is located on the lower edge of the body of the vertebra. The costal facet of the transverse process of the vertebra is a facet for articulation of the vertebra with the tubercle of the rib. In addition, the spinous processes are relatively more pointed than other vertebrae and angle sharply downward. The body of a thoracic vertebra, seen here highlighted in green, is somewhat heart-shaped.
The human spine is made up of 24 spinal bones called vertebrae. The vertebrae are stacked on top of one another to create the spinal column. The spinal column gives the body its main upright support. From the side, the spine forms three curves. The neck, called the cervical spine, curves slightly inward. The mid-back, or thoracic spine, curves outward. The outward curve of the thoracic spine is called kyphosis. The low back, also called the lumbar spine, curves slightly inward. An inward curve of the spine is called lordosis. The lumbar spine is made up of the lower 5 vertebrae. Doctors often refer to these vertebrae as L1 to L5. The lowest vertebra of the lumbar spine, L5, connects to the top of the sacrum, a triangular bone at the base of the spine that fits between the two pelvic bones. There is a joint on each side of the sacrum that connects the sacrum to the pelvis. This joint is called the sacroiliac or SI joint. Each vertebra is formed by a round block of bone called a vertebral body. The lumbar vertebral bodies are taller and bulkier compared to the rest of the spine. This is partly because the lumbar spine has to withstand pressure from the body weight and from daily actions like lifting, carrying, and twisting. A bony ring attaches to the back of each vertebral body. When the vertebrae are stacked on top of one another, these rings form a hollow tube called the spinal canal. This bony tube surrounds the spinal cord as it passes through the spine. Just as the skull protects the brain,
The bones of the spinal column protect the spinal cord. The spinal cord extends from the brain to the L2 vertebra. Below this level, the spinal cord splits into a bundle of nerves that goes to the lower limbs and pelvic organs. The Latin term for this bundle of nerves is cauda equina, meaning horse's tail. As the spinal cord travels from the brain down through the spine, it sends out nerves on the side of each vertebra called nerve roots. These nerve roots join together to form the nerves that travel throughout the body and form the body's electrical system. The nerve roots that come out of the lumbar spine form the nerves that go to the lower limbs and pelvis. The thoracic spine nerves go to the abdomen and chest. The nerves coming out of the cervical spine go to the neck, shoulders, arms, and hands. It is sometimes easier to understand what happens in the spine by looking at a single spinal segment. The spinal segment includes two vertebrae, the intervertebral disc between, the two nerve roots that leave the spinal cord at that level, and the small facet joints that link each level of the spinal column. An intervertebral disc is made up of two parts. The center, called the nucleus pulposus, is spongy and acts like a shock absorber to cushion the force between each vertebra. The nucleus is surrounded by a series of strong ligamentous rings called the annulus fibrosus. Ligaments are made of strong connective tissue and connect one bone to another. The annulus fibrosus is actually a special ligament that connects two vertebrae together. Between the vertebrae of each spinal segment are two facet joints. The facet joints are located on the back of the spinal column. There are two facet joints between each pair of vertebrae, one on each side of the spine. A facet joint is a small bony knob that sticks out from the vertebral body at the back of the lumbar spine. Where these knobs meet, they form a synovial joint that connects the two vertebrae. The facet joints of the lumbar spine move together in a sliding motion as you bend forward and backward. The surfaces of the facet joints are covered by articular cartilage. Articular cartilage is a smooth, rubbery material that covers the ends of most joints. It allows the bone ends to move against each other smoothly, without friction. Two spinal nerve roots exit the sides of each spinal segment, one on the left and one on the right. As the nerves leave the spinal cord, they pass through a small bony tunnel on each side of the vertebra called a neural foramen. The lumbar spine is supported by a complex set of ligaments and muscles. The ligaments are arranged in layers and run in multiple directions where they connect the bones of the lumbar spine to the sacrum and pelvis. The muscles of the low back are also arranged in layers. Those closest to the surface are covered by a thick tissue called fascia. The middle layer runs up and down over the lower ribs, chest, and low back. They blend in the lumbar spine to form a thick tendon that binds the bones of the low back, pelvis, and sacrum. The deepest layer of muscles runs along the back surface of the spine. These muscles connect the lumbar vertebra, pelvis, and sacrum, and coordinate movement with the muscles of the abdomen to help hold the spine steady during activity.
The scapula, or shoulder blade, is a major bony component of the shoulder and functions to connect the upper extremity with the trunk of the body. The scapula articulates with two other bones, laterally with the humerus at the glenoid cavity, which is now seen here highlighted in green, and superiorly with the clavicle at the acromial process. In this short tutorial, we will list the anatomical features of the scapula. First, the angles. They are the superior angle and the inferior angle. Next are the borders of the scapula. The medial border, which is the longest and faces the vertebral column. The lateral border, this is the border of the scapula facing the humerus. And the superior border, which is the shortest and thinnest. Moving on to the bony features of the scapula, and as you can imagine, given its unique shape, there are many. On the anterior surface, there is the subscapular fossa. This is a broad concavity found on the ventral surface of the scapula and serves as an attachment point for the subscapularis muscle. On the posterior surface is the spine of the scapula, which lies between the next two structures we are going to talk about. The supraspinous fossa, which extends from above the spinous process to the superior border of the scapula. And found inferiorly, the infraspinous fossa. This fossa extends below the spinous process to the inferior angle of the scapula. Another major feature is the coracoid process, which, with the acromion, are two important projections of the scapula that serve as attachment points for ligaments and muscles. Not to mention that they protect some of the more fragile structures found on the shoulder joint. Finishing off our tour of the scapula, we note the supraglenoid tubercle. This is a small projection found at the superior margin of the glenoid cavity. Remember this. The supraglenoid tubercle is the origin point of the long head of the biceps. On the inferior margin of the glenoid cavity, you will find the infraglenoid tubercle. This is also an important landmark to remember, since the long head of the triceps arises from this structure.
So we are looking at the interior view of the humerus, and the first structure that you can clearly see here is the head of the humerus, and I'm highlighting it so you can see that it's articulating here with the glenoid cavity of the scapula. Now laterally you can see this prominence known as the greater tubercle, and medially you'll find another prominence, a smaller one, known as the lesser tubercle. Now as you can see, if you go down, this is forming a crest, so the greater tubercle is forming a crest here, and it's known as the greater tubercle crest, or the crest of the greater tubercle. And also the lesser tubercle is forming another crest, known of course as the crest of the lesser tubercle. Now between these two crests formed by these two tubercles, you will find a sulcus known as the intertubercular sulcus. And it's also known as the bicipital groove. And it's known as the bicipital groove because this is where the long head of the biceps brachii, the muscle, biceps brachii, will go through. And I want to show you. So this is the muscle, and the long head is going through this intertubercular groove, or sulcus. If we move distally, we're going to find here a tuberosity. This is known as the deltoid tuberosity. And as the name indicates, this is where the deltoid muscle is going to insert. So you have here an image of the deltoid muscle, and it's using the deltoid tuberosity on the humerus to insert. Now moving further to a more distal point, you're going to find a fossa here, known as the radial fossa, and it's located laterally. Now on the medial side, you're going to find what it's known as the coronoid fossa. Now here you will also find a structure. This is known as the capitulum, and this is what's going to articulate, the structure is going to articulate with the radius. And on the opposite side, medially to it, you're going to find another structure known as the trochlea, and this is what's going to articulate with the ulna. We are now looking at a posterior view of the humerus, where you can still see the clavicle here and the scapula also on their posterior views. And the first structure that we also saw on the interior view was the head of the humerus, so you can still see it here. Now, a little bit more laterally or more distally, you're going to find another important structure right here, known as the anatomical neck. Now, a bit further laterally, you're going to find the greater tubercle that you could also see on the interior view. More distally, you're going to find another neck known as the surgical neck. And you can notice here a groove or a little bit of a depression. This is where the radial nerve is going to pass through, let's say. This is known as the radial groove. Now, you can also still notice the deltoid tuberosity here, laterally, where the deltoid muscle is going to insert. And a very important thing that I need to clarify here, and I forgot to mention on the interior view, is that this long area here of the humerus, this is known as the body or shaft of the humerus. Very important. Now, if we go further down or more distally, we're going to find a few structures that are important mentioning. The first one is the medial supracondylar ridge, and you also find a lateral one, so a lateral supracondylar ridge. Now, you find here what is known as the medial epicondyle, and you also find a lateral epicondyle. One important thing to notice here is this depression that you find medially on the medial epicondyle. We call it the groove for the ulnar nerve. Now you see a very clear, very noticeable fossa here. This is known as the olecranon fossa. And right beneath it, or a bit more distally, you will find what is known as the trochlea. So this is known as the trochlea of the humerus. Now that we just completed the humerus, it is time to move on to this flat, triangular shaped bone known as the scapula, seen here in green. It is also known as the shoulder blade because it is one of the major bony components of your shoulder. Now, in this image here, you can see also two other bones that articulate with the scapula. The first one located laterally, this is known as the humerus, and also superiorly, you can find the clavicle. The humerus is articulating with the glenoid cavity of the scapula, and we're going to see and talk about this structure later on in this tutorial. And also, it is important to know that the clavicle is articulating with the acromial process of the scapula. So before we go on and define and talk about the different bony structures that you find on the scapula, we need to talk about the borders and the angles that you find on this bone. Now, what I have here is an anterior view, also known as a costal surface of the scapula. This is the front part, let's say, of this bone. And I'm going to provide you with the posterior view, or the back side of the scapula, as you can see here on this second image. Now, let's first define the angles, and there are two that you need to know. The first one is the inferior angle, highlighted in yellow. And the second one is the superior angle, highlighted in blue. Now, once we define these two angles, let's talk about the borders, and there are three that you need to know. The first one is known as the medial border. This is the longest border, and as you can see here, it will extend from the superior angle all the way down to the inferior angle. Now, the second border that you need to know is the lateral border, which will go from the lower margin of the glenoid cavity, which is a structure that is articulating with the head of the humerus that we're going to learn about it later on this tutorial, and goes all the way down to the inferior angle. Now, the last one is the superior border. This is the shortest and the thinnest and will extend from the superior angle all the way to the base of the coracoid process, as you can see here. Now it is time for us to talk about the bony features of the scapula, and we're going to start with the image to your left, and this is the anterior or costal surface of the scapula. Now it's important to notice that here you're going to find a structure that is specific or specifically seen on the anterior side of the scapula. This is a flat and slightly concave feature or structure known as the subscapular fossa. Now, if you look to the image on your right, this is the posterior view of the scapula, and here you can also see a few structures that are specific to the posterior side. And the first one is the spine of the scapula, which is also highlighted in blue. And the spine of the scapula is almost like dividing two other important structures that you find on the posterior side of the scapula. And these are the supraspinous fossa, supra meaning above the spine, and also an infraspinous fossa, meaning below the spine. Well, one important notice here is that the infraspinous fossa is much larger than the supraspinous fossa. Now, another feature that we need to highlight here is, if you notice here on the spine of the scapula, you're going to find a triangular base medially, which rises laterally to terminate in a flattened process, and this is the famous acromion, highlighted here in yellow. Now, for your own knowledge, I want to tell you that the acromion forms here an angle known as the acromial angle, and this is a palpable bone point on your body. The next structure that we're going to talk about is known as the glenoid cavity, highlighted in green. This is a very important surface located laterally on the scapula, and this surface will articulate with the head of the humerus, as you can see here on this image, and of course a very important articulation happening in your shoulder joint. Now, the other structure that you're going to find here is a small projection at the upper border of the glenoid cavity. This is known as the supraglenoid tubercle. And then below the glenoid cavity, you're also going to find another tubercle known as the infraglenoid tubercle. Now, you're going to find another structure adjacent to the glenoid cavity. This is known as the neck of the scapula. The next structure that we're going to talk about is found above the glenoid cavity, and this is known as the coracoid process. And as you can see here on this image, the coracoid process is bent at a right angle, lateral ventrally, and has a flattened tip, as you can see here. Now, another important thing to know about the coracoid process is that this structure, alongside with another structure that we talked about, the acromion, these two will perform a very, very important function, is that they will protect the joint that is found beneath them. This is a very, very important joint known as the shoulder joint. So this is one important function that these two structures will perform together. Now, another structure that we want to talk about briefly is found also on the posterior side, and this is known as the suprascapular notch. highlighted in red, as you can see here. And the suprascapular notch is medial, so it's found medial to the coracoid process, or to the base of the coracoid process, and it's on the superior margin of the scapula, or the superior border. The scapula lies on your thorax. The second point is that the base of the spine is at the same level of the third thoracic vertebra. The third point is that the inferior angle of the scapula lies between ribs 7 and 8. And the fourth and final point to make on this tutorial is that when your arm hangs down, the medial margin should be parallel to the row of the spinous processes on your vertebrae.
The shoulder girdle consists of two bones, the scapula and the clavicle, or the collarbone, and the muscles that attach to and move these bones. They are the rhomboids, trapezius, subclavius, pectoralis minor, and levator scapulae muscles. The rhomboid muscles are two diamond-shaped muscles of the shoulder girdle. Both extend from the vertebral column to the medial border of the scapula. They lie over the autochthonous back muscles but under the trapezius. In this area, they are both palpable and often visible. The rhomboid muscles are divided into the rhomboid major and the rhomboid minor muscle. Usually, there is a small space between both rhomboid muscles. However, in some cases, one may find one single blended muscle instead. Both major and minor rhomboids perform the same movement. Their contraction causes a craniomedial movement of the scapula, known as adduction and elevation. At the same time, the inferior angle of the scapula is moved towards the vertebral column, known as rotation. That movement mainly supports lowering of the elevated arm. Another function of the rhomboid musculature is the stabilization of the scapula during both rest and arm movement. The trapezius muscle is a triangular flat muscle of the shoulder girdle and is divided into three parts: the descending or superior part, the transverse or middle part, and the ascending or inferior part. The trapezius has numerous tasks. It stabilizes and secures the shoulder blade at the thorax. It moves the shoulder blade medially and rotates it outward. In addition, the descending part causes elevation of the scapula, while the ascending part depresses this bone. The subclavius muscle is a short muscle of the shoulder girdle, due to its location, lying behind the pectoralis major, and relatively small size. The muscle is hardly palpable. The main task of this muscle is the active stabilization of the clavicle in the sternoclavicular joint during movements of the shoulder and arm. The pectoralis minor is a fan-shaped muscle of the shoulder girdle. It is located under the pectoralis major, and with that muscle forms the anterior wall of the axilla where the contracted muscle can be easily palpated. The pectoralis minor has two main functions. First, it pulls the scapula anteriorly and inferiorly towards the ribs, abduction and depression respectively. This leads to a dorsomedial movement of the inferior angle of the scapula. This movement is both helpful when retracting the elevated arm, as well as moving the arm posteriorly behind the back. Second, the pectoralis minor elevates the third to fifth ribs, given a fixed scapula, and expands the rib cage. By those means, it can also serve as an accessory muscle during inspiration. The levator scapulae is a long muscle of the shoulder girdle. The upper part of this muscle lies under the splenius capitis and sternocleidomastoid muscles, and its lower part under the trapezius. Only the middle part of the levator scapulae remains uncovered in the lateral cervical region, and for that reason, the muscle can be most easily palpated in this area. As the name indicates, the main function of the levator scapulae is the elevation of the scapula. While elevating, it simultaneously pulls the entire scapula medially. This movement is helpful when bringing the elevated arm back to the neutral position. In addition, the muscle also moves the inferior angle away from the back, causing a small upward tilt of the scapula. If the scapula is fixed, a contraction of the levator scapulae leads to the bending of the cervical vertebral column to the side, known as lateral flexion. The pelvis is formed by 4 bones which include a pair of hip bones, otherwise known as innominate bones, the sacrum and the coccyx. The pelvic girdle consists of the hip bones and the sacrum, and its function is to transmit the weight from the upper body to the lower limbs, while allowing the body to stay balanced. The ilium, the ischium, and the pubis, which are the bones that form the hip bone and are seen here collectively highlighted in green, fuse together at puberty to form the innominate bones, and are joined by the cartilage found in the acetabulum. The sacrum, which is a major feature of the pelvis, has the following parts. The superior articular process, the wing of the sacrum, the base of the sacrum, the pelvic surface of the sacrum, and the apex. The last bone in the pelvis is the coccyx, which has 4 fused vertebrae and a single individual terminal vertebra.
The pelvis and the femur. We're going to be dealing with osteology of the femur, and also a specific part of the pelvis that we're going to be dealing here is the hip bone. So we're going to talk about all the bony elements related to the hip bone. What is the bony pelvis? Important thing to clarify before we go on and talk about the rest. What you need to know about the bony pelvis is this structure that you can see here on the screen right now, with other elements as well. You have the 2 femurs here and the vertebral column as well. But the bony pelvis is this structure right here that consists of 2 hip bones and another 2 elements or 2 bones are the sacrum, this bone that you can see right here. As you can see, this is also part of what is known as the bony pelvis. And let's say the 4th element, since we have 4 in total, will be the coccyx. And the coccyx is this bone here joining the tip of the sacrum. But now we're going to be focusing, like I said, on the hip bone. Very important. And the very first thing you need to know about the hip bone, it's also comprised of 3 bones. 3 bones, or the hip bone consists of 3 bones. The first one is this one that you can see here. It's highlighted in green. And this bone right here is the largest one that you find on the hip bone and is known as the ilium. Now the second one is this one here, also highlighted, and this is known as the ischium or ischium. You can pronounce it both ways. I've heard it both ways, so I think it's accepted as both ways. Now, the third bone is this one here, very famous, I would say, bone. It's known as the pubic bone. Now that I just briefly introduced the three main components of the hip bone, it is time for us to talk about a structure where they all meet, and this is known as the acetabulum. Now, the acetabulum, as I mentioned, is a cavity formed by the synostosis of these three bones. So this is the meeting point of these three bones: the ilium, the pubic bone, and of course, the ischium. Now, still on the acetabulum, I want to add something important here, that this is the socket for the hip joint. So this serves as the socket point, or the socket attachment, let's say, for the hip joint. As you know, the hip joint is a ball and socket joint, and for that matter, you're going to have a ball portion that is the head of the femur, as you can see here. And of course, the socket portion where this head will attach will then be the acetabulum. And this is, of course, for me, one of the most important joints of the human body. Now, moving on, I want to talk about a few structures that you find in the or within the acetabulum. And the first one is this moon-shaped structure that is known as the lunate surface. And the lunate surface works as the articular surface of the acetabulum. And as you notice here, it's surrounding the acetabulum. And another important thing that you need to know is that it's covered in cartilage. Very important point. Now, moving on to another structure, this is known as the margin of the acetabulum. And this margin is bordering the acetabulum, as you can see here, or it's bordering the acetabular fossa, can say that, and it is interrupted here by this notch, as you can see here, that is known, of course, as the acetabular notch. Moving on to another structure, and not to be confused with the margin of the acetabulum, this is known as the acetabular lip. And this is a fibrocartilaginous collar on the rim of the acetabulum, as you can see here, that is surrounding the margin of the acetabulum. Very important thing. This is the ilium, and the ilium is divided into two parts, the body and the wing. Now, the wing is this flat-shaped portion here that does look like a wing, and that's why we call it. We simplify things in anatomy. Now, the body is the central part of the ilium that is located near the acetabulum, so this portion right here. And it is also part of the iliac portion of the acetabulum, like we talked about on the previous slides. Now, moving on to the different elements that we find within the ilium, the first one is a line, and it's known as the arcuate line. And this is a smooth, rounded border on the internal surface of the ilium. And this arcuate line is marking, as you can see here, the border between the body and the wing of the ilium. Now, the other structure is known as the gluteal fossa or gluteal surface, and it is an external surface of the wing of the ilium. And the extremities of this gluteal surface serve as the origin points of the different gluteal muscles, so very important. The other one is known as the iliac fossa, and this time this is found internally, so this is in the internal surface of the ilium, and is a large, smooth, and concave surface that you find on the ilium. The other structure that we need to talk about is known as the iliac crest, and this is the superior border of the wing of the ilium. And as you can see here on this image, it's stretching from this spine here, known as the anterior superior iliac spine, and then it's stretching all the way to the posterior part to another spine known as the posterior superior iliac spine. Now, important thing about the iliac crest is that it serves as an origin and insertion point for certain muscles. Very important thing. So it's an attachment point for muscles, including a very important one that you know, and is a very important and large muscle of your body known as the latissimus dorsi. Moving on to another structure, this is known as the iliac tuberosity. And the iliac tuberosity is a roughened area behind the iliac fossa, as you can see here on this image. And it serves as an attachment point to the sacroiliac ligaments. Moving on to another structure, this is known as the auricular surface. And like the name indicates, this is ear-shaped surface which articulates with the sacrum. It is covered in fibrocartilage. Very important point to know about this auricular surface. One important thing about the ilium is that it has 4 different spines located in 4 different positions within the ilium. Now the first one is the one that you see here. This is known, and as I already talked about, this is the anterior superior iliac spine. And it is a bony projection that marks the anterior limit of the iliac crest, like I also talked about on the previous slides. And it is the origin for the sartorius muscle. The next spine is known as the posterior superior iliac spine, and this is a posterior bony process at the posterior end of the iliac crest. Now it's shorter than the anterior, important thing to notice, and it serves as attachment for the oblique portion of the posterior sacroiliac ligaments and multifidus. The other spine is known as the anterior inferior iliac spine, and this is a bony process at the anterior margin of the ilium. Now this serves as the origin points for the rectus femoris muscle. Now moving on to the last spine that you find within the ilium, and this is known as the posterior inferior iliac spine. Now the posterior inferior iliac spine is found right on the superior end or edge of this really important structure that we will talk about, known as the greater sciatic notch. Now just at the tip you find this spine, the obturator foramen, this large opening that you find here between the pubis and the ischium. Now this is really important to mention, especially on this tutorial, because this is where a lot of nerves, important nerves and blood vessels will pass through. So this is a very important foramen in your body. Now the other structure that you find within the pubic bone is known as the symphysial surface. Now this is a surface of the superior ramus of the pubis that will, or the pubic bone, that will unite with the opposite surface through a midline cartilaginous joint, forming this structure right here that you can see on this image. This is known as the pubic symphysis or the symphysis pubis, adding the name right here. So this structure is very important as well. And of course, the participating structure of the pubic bone will be the symphysial surface. Another structure will be then the pubic tubercle. And this is a protuberance that is located on the medial portion of superior ramus and the anterior and lateral to the symphysis. So right here on the superior surface of the symphysial surface. Now this is where the inguinal ligament will attach to. Moving on to another structure, this time we're talking about the iliopubic eminence. And this is a flat prominence at the proximal portion of the pubic bone. It marks the union of the pubic bone and the ilium, as you can see right here. So two bones being united at this portion here, as at this iliopubic eminence, this elevation right here. Now let's talk about another structure, and this one is the obturator crest. Now the obturator crest extends, as you can see here on this image, from the pubic tubercle all the way to the acetabulum. So from the pubic tubercle here all the way to the acetabulum, forming this crest. And it is the origin point for the pubofemoral ligament. Very important origin point for this ligament, the ischium. Now the ischium is also divided into two portions, the body and the ramus. And the body is this portion right here, located just behind the obturator foramen. This is the obturator foramen like we talked about, this large opening. Now the ramus of the ischium is going to be found right here, just below the obturator foramen. Now, still on the ramus of the ischium, I want to add an important point here, that the interior portion of the ramus of the ischium is going to meet right here with another ramus, but this time the inferior ramus of the pubic bone, like we talked about before. So this is a meeting point for the pubic bone and the ischium, the ischial spine or ischial spine. And the ischial spine is a bony prominence, as you can see here, between two sciatic notches. The greater sciatic notch right here and the lesser sciatic notch. And this is the ischial spine just in between those two notches. Now, important structure because it serves as an attachment point for some muscles, including this one that I'm showing you right here, this one highlighted in green, and you can see clearly it attaching to the ischial spine or the ischial spine. The greater sciatic notch, and this is a large notch that you find between the posterior inferior iliac spine right here, and goes all the way down to the ischial spine that we talked about previously. Now, an important thing that you need to know is that once you add this ligament here, this important ligament that is known as the sacrospinous ligament, then this notch will become what is known as a foramen. And this foramen is then used by a lot of important structures to pass through, including the piriformis muscle and this structure that you see here highlighted in green, very important nerve known as the sciatic nerve. So this is passing through that foramen that is formed by this ligament and the greater sciatic notch. Let's move on to the other notch, and this time is going to be the lesser sciatic notch. And the lesser sciatic notch exists between the ischial spine, as you can see here, and extends all the way to another structure that we're going to talk about next, known as the ischial tuberosity, right here. Now, it also converts into a foramen once this ligament is present, this large ligament, that is known as the sacrotuberous ligament. Also, the sacrospinous ligament, which is also present here, will help to convert this lesser sciatic notch into a foramen. Important thing to add as well. Now, the structures passing through this foramen include the obturator internus muscle, the nerves that supply the muscle, and internal and pudendal vessels and nerves, just for your information. Moving on to another structure, the last structure of the ischium, this is the tuberosity of the ischium, and this is a ischial or ischial process at the lower end of the lesser sciatic notch. Like I mentioned before here, the lesser sciatic notch will extend up to the tuberosity of the ischium, and of course this is the structure that we are highlighting right now. It is time to move on to another bone, this time located a little bit further down, and this is the femur. Now, the femur is the largest tubular bone that you find on your body, and it's also known as a thigh bone. And in terms of elements, let's start with the very first one. It is known as the head of the femur. And I already talked a little bit about this element. And what you need to know is this is the ball part of the ball and socket hip joint. Now this is going to be articulating with this portion here of the hip joint known as the acetabulum. Very important part. Now another part that I want to highlight on the head of the femur is this depression right here that is used for the attachment of this ligament that is cut right here. This is the head of the femur ligament. And this is a very important ligament because this helps the connection between the two bones, helps strengthen this connection. Now moving on to another part, the largest portion of the femur. This is known, of course, as the body or the shaft of the femur. Moving on to the next one, this time we're going to talk about the neck of the femur. And this is the portion that you find between the head, right here, and this other portion that we're going to talk about next, known as the greater trochanter. The greater trochanter, this is a large prominence on the superior lateral aspect of the femur shaft. And is used for several things, especially attachment of different muscles, including the gluteus medius that you can find here on this image, and is attaching here to this greater trochanter, and also others like the gluteus minimus and the piriformis muscles. If you have a greater trochanter, you have to have, of course, a lesser trochanter. And the lesser trochanter is a small prominence that you find on the posterior medial aspect of the proximal femur shaft. And it serves as an attachment to a very important muscle known as the iliopsoas muscle. Now, between the two trochanters, you find a line. This line is known as the intertrochanteric line. It's a rough anterior line between the shaft, as you can see here, and the neck of the femur that is hidden behind these ligaments right here. And this line is running as well from the greater trochanter all the way down to the lesser trochanter. Now, on the posterior side, you find as well another line, let's say, but this time called the intertrochanteric crest, that is also between the neck of the femur and the shaft, and runs as well from the greater trochanter all the way down to the lesser trochanter. Now, enough about lines. Let's move on to, oh no, another line. And this line is known as the linea aspera. In Latin, this means rough line, and it is indeed a rough double line on the posterior aspect of the femur. And this is an important line because it serves as insertion and attachment points for many muscles, including the gluteus maximus. As you can see here, the gluteus maximus is inserting as well on the linea aspera. Now, the next structures that we need to cover on the femur are these that you find on the distal portion of this bone. Right here, you have a lateral one and also a medial one, and these are called the condyles. So you have a medial condyle of the femur and a lateral condyle. And between these two structures, there is another structure known as the intercondylar fossa, as you can see here. And this is, of course, separating these two femoral condyles. And it's a posterior notch, as you can see here. It's found on the posterior side of the femur. Now, moving on to the other structures here. Now, this time we're going to talk about bony elevations that we find on the aspects of the different condyles. And the one that we see here is known as the medial epicondyle. Important thing. The medial epicondyle is a bony elevation that you find on the medial aspect of the medial condyle. And also on this medial epicondyle, you will find a very important structure known as the adductor tubercle. And this is this tiny elevation that you find right here. This is a small process that is located above the medial epicondyle. And it's very useful because it's a point for attachment or insertion point for the adductor magnus muscle, seen here highlighted in green. If you follow here, here is where it's attaching on this adductor tubercle found medially. Now, the last structure that I want to talk about on the femur is known as then the lateral epicondyle. And this is, of course, a bony elevation that is found on the lateral aspect of the lateral condyle. The ligaments. Now, the ligaments that connect the femur to the hip bone or vice versa. Now, the first one that we're going to talk about is one that I've discussed briefly when I talked about the head of the femur. And this is, of course, the ligament of the head of the femur. Now this ligament extends, as you can see here, from this portion here of the acetabular notch all the way to this depression here on the head of the femur. Now, moving on to another ligament, this one you can see a little bit better on the anterior portion here. You can still see it a bit on the posterior portion, but just a tiny bit. And this is known as the iliofemoral ligament. This is a strong anterior ligament, as I mentioned, of the hip joint capsule, which extends from the ilium all the way to the intertrochanteric line that we talked about. See why this is important to talk about all these bony elements, because this is a point of attachment for this specific ligament. Now moving on to the other ligament, this is known as the ischio or ischiofemoral ligament, and it starts into the orbicular zone from the posterior margin of the acetabulum and is also attached to the anterior margin of the greater trochanter and the intertrochanteric line. So as you can see, it goes all the way to the front to the intertrochanteric line, and it starts here on this acetabular margin. Moving on to the other ligament, this time is the pubofemoral ligament. And this ligament arises medially, as you can see here, from the joint capsule of the pubic bone and extends to the orbicular zone and to the part of the femur proximal to the lesser trochanter. So it goes all the way closer to the lesser trochanter. The last ligament that we need to briefly talk about is known as the transverse acetabular ligament. And you can guess by the name that this is a ligament that is bridging the acetabular notch and completes the articular surface for the head of the femur, helping it stabilize and stay inside the acetabulum.